Time now for our Sunday specials. Healthcare emergency is escalating in Makoko as thousands of displaced residents face a surge in waterborne diseases following recent government demolitions. Was the community entirely cut off from formal clinics, families are turning to unregulated herbal remedies to combat a spike in malaria and typhoid. Balabo Famous Call reports from the waterfront.
A quiet melancholy greeted us as we returned to the floating community after morning showers caused water levels to rise. Smoke from fish being processed drifted into the sky, a reminder that this, the world's largest floating slum, is also a fishing community. The toll of recent demolitions remains stark. The chant of Yebo from watchful children along the waterfront signaled our arrival as visitors. The stench was overwhelming, thick and choking, yet for residents here, the same water is a lifeline. It is where they bathe, swim, and for many children, defecate openly. It is simply a way of life. Wisdom remnants of demolished structures blankets the water.
Here are people ravaged by malaria, typhoid, and persistent fever, yet they are finding the strength to smile beneath the rubble of what were once their homes. For a moment, it almost felt like Venice, but the floating debris here and the murky water are a stark reminder of a community in dire need of medical intervention or help.
There are no toilets, no structured waste disposal system. Homes, mostly makeshift, are tightly packed, clustered like honeycombs above the water. Falling ill here comes at a high cost. The community remains cut off from formal health care. In the absence of clinics, treatment is largely self-administered. Beyond over-the-counter medication, many residents rely on patent medicine vendors and unregulated herbal remedies, locally known as agbo, sold along the Makoko waterfront. These mixtures are often marketed as cures for a wide range of illnesses, despite the lack of medical testing. This head teacher at a floating orphanage who has resumed classes despite the demolition shared her concerns about the widespread use of uncertified herbal treatments.
Last year we lost 2 of our students due to the herbs they were giving, because the sickness that was dealing with them then was not something herb can treat. It is what hospital can treat. But then this hospital has not been in existence. So with the parents, we are just giving the child herbs till the child had to do surgery. So unfortunately, we lost the child due to the herbs it was given. So we cannot say the herb is 100% accurate, can cure them, no.
Janet Wewutu, a petty trader who sells sawdust by the waterfront, says accessing proper medical care is a luxury. Her grandchildren have suffered from malaria and typhoid, and she says a primary remedy remains local herbs.
Most times, we depend on local herbs. When we are sick here, We need a medical center at the waterfront so that our children can be well vaccinated and safe.
Herbal mixtures typically sold in reused plastic bottles are prescribed for malaria-like symptoms. For as little as 300 naira, residents can purchase a 50 cl portion. One seller, wary of being identified amid fears of further demolition, avoided our cameras, leaving her daughter to tend to customers.
And it's very hot. What will I use it for? It's for fever. So if somebody has fever, if you take this one, you'll be all right. So what happens after I take it? Will I pee or something? And this is just for 200 naira, 300 naira.
The use of herbal remedies here is an age-old practice passed down through generations in Makoko. These mixtures are brewed from leaves, roots, bark, and sometimes lemon. However, there is no scientific evidence confirming their effectiveness in treating malaria. According to the World Health Organization and the Nigerian health authorities, commonly used plants such as neem, locally known as dongoyaro, and betel leaf have not been medically proven to cure malaria.
Like the dongoyaro, we know is one thing that can cure malaria. We all know about that. But the truth is, these things have to go through rigorous testing and standardization. Because if you ask me to take dongoyaro, what quantity am I taking? What dose am I taking? For how long am I going to take it? What are the side effects of those concoctions? And then if I have any problem from those concoctions or herbal remedies, what are the solutions to those? If I give you chloroquine, for example, I can tell you these are the things it may cost you. If you have this or this or this, please report back. And when you come back, I'll know what I'll need to do to be able to get you out of that problem. I can tell you how many tablets you need to take for how long. But with those things, there's really no standardizations.
The WHO maintains that artemisinin-based combination therapy, ACT, remains the first-line treatment. It warns that reliance on unverified alternatives can lead to incomplete treatment, increasing the risk of severe complications or deaths.
You hear about people talking about renal failure all over the place. That is one of the things that will lead to renal failure. Because by the time you start taking things, you don't know the constituents of those. Your kidneys are the ones that would have to deal with those toxins you're taking in. And by the time they get overworked over time, they're going to fail. Okay? So they don't help anybody in any way. I remember when I was a resident doing my training in Luz, where I trained to become an orthopedic surgeon. I had a few of them coming like that. Many of them will have rupture of the intestines, rupture of the stomach and all that, all because they took toxins that nobody could explain what they are. It's only when you start digging in and start getting the issue, they'll begin to tell you, they mix something with ogogoro, they mix something with that, and I had to take it. And then after 2 days, I started having this, So the truth is, we are only creating more problems than we are solving by people taking all those herbal remedies. They don't help anybody in any way.
Since the demolition, health conditions have worsened. Some residents reportedly died from shock, while others became more vulnerable to waterborne diseases as debris scattered across the waterfront further contaminated the environment. In response, a community member, Obajano Ewedonton, through its philanthropic efforts, has set up a temporary medical tent expected to operate for 3 months. Our journey to the site took about 25 minutes by wooden boat, navigating through floating debris that blocked parts of the waterway. From there, we trekked along muddy path left by the morning rain before arriving at the medical tent, which shares space with an Orthodox church. The presiding minister welcomed us. Around 200 displaced residents now sleep in the church auditorium, their belongings filling every available space. He says many have arrived with urgent medical needs, making the presence of the medical tent critical.
Yes. In this church, we have most of our members living in the waterfront there. And after the demolition, all of them are here, staying, sleeping in the church. And some of them doesn't have a mosquito net. Some of them died during the demolition, and nothing we can do about it. And we just pray God that we bury them. Malaria, fever, what else? Sugar level, everything. Even myself, they treated me out.
These are the only drugs this makeshift clinic can provide for thousands of displaced Makoko waterfront residents. You can literally count them, which shows that they're far from enough. Access to healthcare here remains dire.
One displaced resident, Irene Keita, who arrived with her 4 children, says she was relieved to receive treatment for malaria and body pains, conditions she previously managed with herbal remedies. She's now appealing to the government for support, especially in providing shelter for displaced families.
There is no place to call home. It is not easy. When we are sick, it is even more difficult for us. The government should please help.
Health workers were absent during our visits due to heavy rainfall. However, the initiator of the medical outreach says sustained support from the government and citizens could help establish a permanent floating clinic.
You know, after the demolition, there is nothing like medication in the community. Nobody is receiving any medication in the community. A lot of death, we lost a lot of people. So far, we have attended to over 1,000 of people since when we started in February. We used to attend to 40, 50, 60 people every day. Before that, I've been planning to build a hospital in Makoko community because we don't have any access to quality health care in the community. When I was planning, when the demolition started and they demolished a lot of places, I don't have anywhere to build the hospital again. And I think because people are really facing health challenges, that's why I think, and I partner with another organization and we establish this tent here. And this tent is for the community to have access to quality health care. And when they come every day, we used to ask them to come. When they come, we check their vital signs, their BP, their TP, their temperature, and their sugar level. So they go to doctor here, tell doctor their complaints, and doctor prescribes drugs for them, and we give them drugs.
Although authorities have labeled Makoko an illegal settlement, Obajana argues that agreed demolition procedures may not have been fully followed.
Lagos state government is doing well. And we really appreciate, we the residents of Makoko, we really appreciate it. But that is not the initial agreement that we have with the Lagos state government. The initial agreement was that we should step back from the power line 100 meters. They even told us 30 meters, from 30 meters to 50 to 100. So you cannot tell somebody step back 100 meters, you now want to take the whole community, even that you want to develop the community. Our grandfathers have been staying here for over 200 years. Government should look at that and see how we can, if not something they want to take over, relocate us or move us or chase us away. Government should praise and consider this because we don't have anywhere to go. There's nowhere because we are all fishermen. Most of our people, they're based on fishing. If they move them to where they will not be able to develop. So we want to stay in Makoko community.
Despite its limitations, the temporary medical outreach has brought some relief. Janet, a grandmother, says one of her grandchildren has recovered from severe skin reactions after receiving treatment at the facility. The community is calling for more mosquito nets and the establishment of a floating clinic.
But since after the demolition happened, we also have to accommodate some students since they don't have where to stay or where to sleep. We have to accommodate them in our school for them to be sleeping. And right now, we have almost 100 students staying in the school. But the mosquito nets we have, though, is not enough for all of them. So we have to squeeze 4 or 5, 6 students to sleep in a net, which is not even enough. But we are just managing.
Our investigation shows malaria remains a major health threat in Makoko, with high prevalence and little access to formal care. Nigeria continues to be the highest malaria burden globally, accounting for roughly 31% of deaths worldwide, with estimates ranging from 184,000 to over 300,000 deaths annually. As we left Makoko, knowing that without urgent intervention, many, especially children, remain at risk of severe illness or death due to poor sanitation and limited access to health care, and hope the local government will send some support to the beleaguered community. Bolabo, Famous School, TVC News, Lagos.
Makoko, a community facing demolition and in dire need of healthcare. Hopefully their cry is heard and the much needed care provided for them. But that's it on TVC News at 10. For more updates on the stories we're monitoring, visit our website, www.tvcnews.tv.